Hi, everybody. Now, let's look at why we're actually doing fear setting in the first place. We're doing it because there is something around that is making us anxious, and it should make us anxious. We should be worried about it. And if we're not worried about it for us, we're worried about the potential impact on other people or the impact on our workplace. In fact, we're anxious because the whole world is talking about this. We can't walk around. We can't do the normal things that we could do before. All social media, TV, news, etc., is just bombarding us with worry, fear, messages, etc. So really, the outside world is demanding that we pay attention to it. And this has turned on the alarm bells in our brain. So of course you're anxious. Of course, this is what your body does in a threat or a potential threat. And what it's resulted in with some people is feelings of panic, worry, confusion, and some sleepless nights. I know that I've had a few, a couple of weeks ago. So there's nothing to be ashamed of there. This is normal, and this is what our body does. So our bodies have gone into survival mode. Just like it did in our past when we were, running around in caves, when lions and tigers were the threat. But you need to know your body is made for this crisis. Your body is made to deal with this. And this is partly what it's doing already. We're just going to utilize what your body does and just do some fine tuning. So our brain was made to deal with stresses in the environment. You can see here we've got the limbic brain, and the basal ganglia and the thalamus scan the environment for potential threats. So there's more, it turns off on the alarm bell. So there's more energy in our body to deal with the situation. Your heart rate increases, your respiration rate increases, although it's really just in the top half of your lungs. Just to deal with the stress. We get the fight and flight happening. And the brain, and we stay awake because the brain feels like it's at risk and it wants to keep you alert to deal with the problem. And that's why we're all having a little bit of trouble sleeping. It sort of feels like a problem that hasn't been solved yet. And our stress is turning off that front part of our brain, the prefrontal cortex, if it's getting too much stress. And the prefrontal cortex is the thinking part of our brain. So it means that we're not able to think so clearly, and sometimes it's really super hard to make decisions. The other factor I mentioned earlier in the introduction is there's a thing called cognitive overload from all the new actions and protocols and decisions. And these also use up a lot of energy in our brain. Our brain is a huge consumer of energy, and it triggers also in the limbic brain stress. So we've got stress giving us cognitive overload, and we've also got cognitive overload giving us stress. So we've got this circle going around. So either one on their own is hard to deal with, but both, it's really, really tricky. So everyone is stressed right now or has had in the last few weeks times of increased stress. It's normal. So as I said, our brain is scanning the environment. It's trying to solve the problem. It's trying to solve this fear. It wants us to make sure we're going to do something about it. It wants us to stop this fear and prevent it from hurting us. So this is also going to lead to rumination, because our mind is like Google. It's like trying to search for an answer all the time, but often the thoughts go round and round and round in your brain. So the problem here is we aren't doing the right things to calm the brain. So what we need to do is work with our brain in regards to the fear. We need to face the fear. Doing yoga does not help you outwit a tiger. You need a strategy to fight the tiger, and that is what fear setting is doing. It's paying attention to the fears. What our brain is trying to tell us is a threat, and it's going to be making a strategy on paper to calm the brain and let it know you have this covered. You are telling the brain that you are not on autopilot by doing this fear setting and letting yourself being a victim to your thoughts and your environment, and letting your brain know that you are the ruler. So get your paper and pen ready and let's get fear setting. Okay, let's get down to it. We're going to be talking fear setting. So there's no doubt about it. There's so many emotions that are going through our bodies right now. Sometimes it seems like all anybody could talk about is COVID-19. And so what feelings are going through your body right now? What are you noticing? And what have you been noticing that you've been talking to other people about? What you talk about gives you clues to how you're feeling and how you're dealing with things. So let's just talk about what to do with these fears and these feelings. Later on, we'll be talking about some, things like breathing and all that sort of thing that definitely make a difference. But I wanted to start with something novel and something new, something that you haven't done before. So to start with, what we're going to do with our fears, and it could be grief that you're feeling. Some people are feeling grief, preempting in their mind that something really bad is going to happen to somebody that they know or that they love. Again, this is really normal. And that's the first step, is to normalize how you're feeling right now. You need to make it normal. You can't be making yourself wrong right now for feeling anxious. So the first step is to take a big breath. Take one now with me if you can. And just tell yourself that you're normal for how you're reacting and how you're responding. This is very unusual times. So now step one is it's normal. And of course you're feeling like this, of course. Step two is I want you to name what you're feeling. Name it. Is it fear? Is it grief? What is it? Is it anxiety? The next thing I want you to do is I want you to expect it to come up. I want you to notice during the day how many times it does come up, just so you're getting to know it a little bit more. So first we normalize it. Of course you're feeling like this right now. And then we're expecting, noticing and naming. Got that? All right. So now let's go to fear setting. So what happens is when we're stressed, our brain often amplifies things that we're worried about. It makes them bigger in our world. So let's look at it like this. I'm going to draw something on my note. So let's look at risk over resources. So I've just got a little picture here to show you. So we've got anxiety equals, up the top is like a little world. And that's everything that is outside of us, real or perceived. It's like, a telecom bill can feel like nothing some months, and other months it may feel really big because we're stressed or a little bit tight for cash, so it makes the world outside bigger. And resources is anything that you've got access to that's it's like your past skills, it's your procedures, it's your friends, it's your resilience, it's knowledge, it's money in the bank. Resources is something that you also is real or perceived, because sometimes we don't even acknowledge the strengths that we have. So this is a really useful thing to think about when we're thinking about COVID-19, because if we're making the world outside bigger, like we're focusing a lot on COVID, and we're making ourselves small, is in, say the potential for risk is big, so you can see what I've done here, and this is our resources, this is our small, like we're hopeless, we can't do anything about it. It means that we have a lot of anxiety. And so what we're going to be looking at today is the real
and the perceived fear. Let's go to the first part of our PDF, and it's the worst case scenarios. And isn't this what our mind does when it makes us think about COVID-19? We're going through the what ifs, we got the overthinking, and what I'd like you to do is pick up at least one worst case scenario, and we're going to work. Worst case scenario is that it could be that I get sick, or it could be that I'm having to do lots of doubles, or that my husband's going to lose his job and I'm the main breadwinner, and God, I feel like I need a break as it is. You know, that could be your worst case scenario that you're thinking about, or that your kids get sick, or you get stuck at home for months with your kids. I don't know, whatever it is, just write it down. Okay, probably the top of everybody's mind right now is preventing infection. So I'm wondering if that could be the worst case scenario that you would like to put down, is that I could get infected myself. So now it's time to go to prevention. So what can I do to prevent this from happening? And I'm sure you've got a lot of ideas. So just pause now and just write them down and list them, because remember, writing things down is extremely powerful. It's going to give your brain a very powerful message about what you can control and what you can't. So have a go now. So I hope you've listed a few things. And so I want to ask you, what else could you do to prevent it? Like for me, myself, preventing it, I've decreased drinking alcohol. I've increased my diet. I'm really super vigilant with my diet, and I'm also taking, you know, some good supplements. Making sure I exercise and sleeping properly are my priorities. So maybe they're things that you've put on that you've missed out. So just have a little think about what else you can put down. Okay, and in prevention, what could you say to yourself that could help you preventing this worst case scenario? Is there any new knowledge that you need to get? I'm wondering if there's somebody you really admire in the field. If you ask them, what would they say about this? What thoughts are you having right now as you're looking at prevention? Now let's go to what happens if this worst case scenario actually happens. I know you don't want to think about it, but sometimes really taking it right to the nth degree can help you do with this. So perhaps, so this is, if you have it, how can you come back from this? Can you fix it, or can you repair it? So you could even in your mind, the worst case scenario could be, I get sick and I pass it on to somebody else. So what would you do then? How would you fix that? I really want you to go down to the deepest fears that you've got about this and write it all down, like really what would or could be the outcome of that, and what could you do about it. So again, now writing the, you know, if the worst thing happened, what could you do about it? And if the worst thing happened and you're wanting to fix and repair it, what could you say to yourself that could be really helpful right now? Is there anybody that you could get to help you? Is there a resource? Is there a expert